My name is Candice Miller, and today we will focus on the pro side of the debate for the need of a national dental care plan. Over the next 10 minutes, I will provide an overview of the proposed Canada National Dental Care Plan, important terms related to this discussion, arguments for a dental care plan, including the impact of poor oral hygiene on socioeconomic status, lifestyle, physical health, healthcare costs, and mental health impacts. And I will summarize some of the key arguments against the National Dental Care Plan. In 2023, Canada announced that they have created a National Dental Care Plan for families and individuals with an annual income of $90,000 or less. No cost share is available for those with an annual income of less than $70,000. With a staggered rollout over the next 2 years, the National Dental Care Plan will support 6.5 million Canadians in accessing required dental care. First, let's clarify a few terms that will be discussed. Oral hygiene refers to all mouth care, such as brushing, flossing, and routinely seeing a dentist. In this discussion, a dental care plan means a portion of or all care provided by a dentist that is covered by an insurance plan funded by the government. There are several reasons why a national dental care plan is so important. First, socioeconomic status. There is a need to improve access to oral health from birth to end of life. Studies done by Gomes and Brennan show a distinct link between a person's socioeconomic status and oral health. The National Dental Health Plan reaches those in a lower socioeconomic status and thus will improve oral health. NASION states that the intake of alcohol, carbohydrates, and tobacco deteriorates a person's oral health. Researchers Poonawalla and Ball also link alcohol and tobacco to persons in poor socioeconomic situations. Thus, the National Dental Care Plan will reach this group and improve oral hygiene rates. Multiple studies have shown that poor oral hygiene contributes to different types of infections. Researchers Wise and Mincook demonstrate the link between oral health and pneumonia. Researcher Call demonstrated a link between oral health and infections in artificial joints. There is a documented link between poor oral hygiene and increased risk of cardiovascular disease, including stroke and myocardial infarctions. The Government of Canada states that those with gum disease are 2 to 3 times more likely to have a heart attack or stroke than those who have healthy oral hygiene. New research is showing a potential link between poor oral hygiene and ALS, diabetes, and dementia. Those with ALS show that poor oral hygiene may correlate to decreased functional status and survival time. Persons with diabetes are more likely to have fewer healthy teeth than those without diabetes. And Kumar states that there is a link between poor oral hygiene and loss of cognition in persons with dementia. A link between poor oral hygiene and increased risk of mouth and throat cancers has been demonstrated by several researchers. According to the Canadian Cancer Society, 5,400 Canadians were diagnosed with oral cancer in 2020. If caught early by routine dental care, the cost to the healthcare system decreases and chances of a cure increases significantly. A systematic review done by Ribeiro Rota shows that inpatient costs for oral cancer were 968% higher than those treated in outpatients. Advanced cancer staging was also more costly than the early cancer staging by almost 350%. The economic burden of oral cancer is substantial, though underestimated. Pregnant women struggle with changes to their mouth and teeth. New studies are reporting an increased risk to pregnant women and their unborn child related to poor oral hygiene and risk of infections. The Government of Canada states dental surgery under anesthesia accounts for 1/3 of all surgeries performed on children between the ages of 1 to 5 at pediatric hospitals. Many of these surgeries could have been prevented if oral health was available early on. Researchers at the University of Toronto state that providing access to dental care will improve health outcomes and reduce healthcare costs. The National Dental Care Plan will decrease healthcare costs as oral hygiene is linked to multiple health concerns that cost the healthcare system $1.8 billion in 2017. The Government of Canada also estimates that 2.26 million school days and 4.15 million working days are missed each year due to oral health concerns. Researchers Moraes, Patel, Au, and McNamara have shown a link between poor oral hygiene and increased risk of depression and anxiety. New research by Tamrat and Menon highlight that transgender population is struggling with managing oral care and thus are struggling with increased mental health concerns. Quality of life is important for everyone. Poor oral hygiene has been linked to decreased quality of life in all populations. The National Dental Plan will support many at-risk populations to access timely oral care and thus improve their quality of life. Not everyone is for a national dental care plan. Opposition states that Canada's new dental care plan misses a large population of vulnerable people. Even so, the National Dental Care Plan is a good start on addressing oral hygiene for low-income individuals and families. Several studies support the need for education and awareness on the importance of oral hygiene. Many believe that education should come before a national dental care plan. If there is no available dental care, then what use is the education? Special populations, such as the homeless, seniors, and those with physical and cognitive disabilities, still require specialty care. More trained providers are needed, and the National Dental Care Plan does not provide this. Again, if there's no financial support, special populations cannot access specially trained dental care providers. And finally, Indigenous populations are not covered by the new National Health Care Plan and continue to have limited access to dentists, especially in Northern Canada. In summary, a national dental care plan is needed in Canada. Lifestyle choices and socioeconomic status go hand in hand with poor nutrition, increased tobacco and alcohol use, and lack of accessing dental care. Poor oral hygiene is linked to cardiovascular disease, diabetes, cancer, and several other health concerns. More research is showing that pregnant women are at risk for dental and oral changes related to pregnancy that lead to poor oral hygiene. If this is not addressed, the fetus is at risk for infection related to the poor oral hygiene. The Government of Canada estimates $1.8 billion could be saved annually by implementing the Canada National Dental Care Plan and preventing healthcare costs related to poor oral hygiene. Quality of life and mental health affect all population groups and are directly linked to poor oral hygiene. Research supports the need for a national dental care plan, and Canada is stepping in the right direction with this plan.